Remove the patient's shoes and socks or stockings. Weigh the patient in clinic if possible. Correct weight is extremely important when calibrating the patient's sole supports orthotics. Please be sure the weight is accurate. Have the patient sit at the edge of a stable surface with thighs roughly parallel to the floor or casting surface. Roll up clothing to at least mid-calf for good foot visibility during casting. Have the patient keep their knees about 2 feet apart. This helps prevent leg angulation during casting. Place the cardboard casting box next to the foot to be cast. Gently lift the foot and slide the box under the foot, centering the foot on top of the foam from front to back. In most cases, this will place the foot in the corrected position, knee directly over the ankle, and the second metatarsal in line with the thigh. Be aware, with severely pronated feet, you may have to physically realign the second metatarsal with the thigh before casting. Important: make sure the medial side of the heel and forefoot is about 1/2 an inch from the tallest edge of the foam box. This ensures there is sufficient foam to capture the arch. Make sure the leg is vertical, perpendicular to the box when viewed from front and side. Remember, walking on flat feet over time causes the ligaments of the foot to adapt. Some ligaments stretch and others tighten. Consequently, as you push the heel and the medial forefoot into the foam while casting, the tightened ligaments can sometimes cause the midfoot to carry with it and push the arch lower. The resultant orthotic will not give the patient the proper correction because the foot was captured without the highest arch possible at midstance. Ensuring that the arch remains in its optimum position is easy by following these simple steps. With the opposite hand of the foot being cast, grasp and raise the navicular before grounding out the heel. This helps to preserve the arch and not allow the tightened ligaments to carry the midfoot with them and depress the foam excessively. Locate the head of the fifth metatarsal. Place your fingers hand over hand on top of the head of the fifth metatarsal and using a quick, clean thrust, bottom out the fifth metatarsal into the foam. Now push the toenails all the way down. This releases tension on the plantar fascia to avoid its impression in the arch of the cast. Now, before grounding the first metatarsal, place the same sided hand on the medial malleolus and push it slightly up to preserve the arch in the foam while grounding the first metatarsal. Push the first metatarsal down and back to ground it. Remove the foot from the foam and inspect the arch. By raising the navicular and malleolus, you have captured the most arch possible for the patient at midstance, in spite of the tightened ligaments. This ensures proper orthotic calibration and postural correction for the patient. Now repeat the procedure on the left foot. Once finished, you are ready to check your casts. Check the rear foot area for vertical walls. If the heel appears to be inverted in the foam and there is a shelf of foam over the medial rear foot, you will need to recast. This means that the knee was allowed to move outwards and the leg entered the foam at an angle during heel thrust. Now use a conical tipped pen to test the depth of your impressions at the center of the heel, first and fifth metatarsal heads. A cone tip will make a progressively larger hole in the foam the deeper it goes. So if the cast was bottomed out correctly in these three critical areas, the heel, the first and fifth med heads, you should see the same sized hole in each place. Make sure you do not push through the cardboard, as this will make the hole look larger. The holes need to be only roughly the same size. If one area has a clearly larger hole than the others, then that area was left too high. This can be easily corrected by carefully reinserting the foot in the foam and bottoming out the high spot. Take extra care not to depress any arch foam as you bottom out the high spot. Once you are sure that all areas have been properly bottomed out and the conical pen has left the holes roughly the same size, you're done. After you have finished casting your patient, you must properly pack and label your casts for shipping to the Sole Supports lab. Carefully fill the cast indentations with soft tissue paper or wadding to help protect the integrity of the cast during shipping. Fold and insert the completed design form for the orthotics into one side of the casting box on top of the tissue paper or wadding. Fold the casting box in half and tape along the edge where the two halves of the casting box meet. Note, use packing tape, not Scotch tape, to hold the box halves together for shipping. When your account was established with Sole Supports, UPS set up a shipping account for your practice. You received a link from Sole Supports to access your shipping account. Click on the link and enter your login ID and password. Your login ID and password are your Sole Supports account number. Once you have entered your account number in the login and password fields, click the Remember Me box. This will keep your information in the system, so you will not need to enter it every time you access the shipping site. Click Continue to proceed. Important: in order to receive a pickup on the same day, you will need to confirm the pickup prior to the scheduled cutoff time that is shown on the portal screen. If you attempt to process the shipment too late, the system will prompt you to schedule a later pickup time. Specify whether this is a rush order. Be sure to mark yes if there is a check, cash, or other monetary instrument enclosed in the casting box. Finally, specify how many casting boxes are to be included in the shipment. Click the Process Shipment button. Once you click Process Shipment, a label will be displayed. Print the label and place it in the clear window UPS envelope that came in your casting box. Close and attach the label to the box. Once you have printed and attached the label to the casting box, you must click here to schedule a pickup, so it will be logged with UPS. This mass casting technique is fast and fairly simple, especially with a little practice. If you have any questions, feel free to call Sole Supports Tech Support at 888-650-7653, extension 282. That's 888-650-7653, extension 282. Thanks for watching.